Welcome to Precision Cornea Center. This video will discuss the Pterygium excision and conjunctival autograft procedure. We will review how to prepare for your procedure, what to expect on the day of, and instructions to follow postoperatively. Let's begin with how to prepare for your Pterygium procedure. Your initial appointment at Precision Cornea Center will involve a consultation with the surgeon, at which time your candidacy for the procedure will be determined. Please anticipate that your procedure will take place on the same day of your consultation, so long as your surgeon deems it appropriate. In some cases, the surgeon may advise alternate non-surgical management strategies for your condition. In addition to the explanation provided by your doctor at your consult visit, you will have received an information package on the Pterygium procedure. Pterygium is a benign, wedge-shaped growth of conjunctival tissue over part of the cornea. It can cause various symptoms, including redness and inflammation, eye irritation, foreign body sensation or burning, or blurry vision. Several risk factors can contribute to the development of pterygium, including prolonged exposure to UV light, dry climates, exposure to wind and dust, or family history. Your surgeon may tell you that pterygium excision is indicated if the above symptoms are significant or if the goal is to regularize the corneal surface in preparation for cataract surgery. Although this is considered a minor procedure, some risks include infection, prolonged inflammation or poor healing, or pterygium recurrence. Here is what you need to bring to Precision Cornea Center: your Ontario health card or other insurance coverage information, and an updated list of all of your medications. Please leave all of your valuables at home. A responsible adult must accompany you and drive you home from our center on the day of your procedure. If you are under 18 years of age, a parent or legal guardian must accompany you. There is no need to adjust your medication schedule leading up to your procedure. While you are not required to be fasting, please refrain from consuming large amounts of food or fluids prior to your procedure. Please be aware that you will need to come in for a follow-up visit approximately 1 week after your procedure. Your doctor will inform you if you will require a 1-month follow-up visit as well. If you become ill or for any other reason are unable to keep your appointment for your procedure, please call our office the day before at 613-746-2244. Now let's talk about what to expect on the day of your Pterygium excision and conjunctival autograft procedure. Precision Cornea Center is located at 1730 St. Laurent Boulevard in Ottawa. Patient parking is available in front of our building in designated spots noted by the indicated signs. We are located on the main floor of the building. When you enter the clinic, you will need to present your Ontario health card or other insurance coverage information at the front desk. You will be greeted by our lovely front desk staff who will notify a member of the team that you have arrived. We will ask you a few questions to verify your medical information. You will be asked to sign a consent form confirming the procedure and the eye to be operated on. These multiple checks are done intentionally to ensure the quality and safety of your procedure. Just before your procedure, you will meet your eye surgeon and the operating team, which may include a resident physician or a cornea fellow working with your surgeon. The team will review your medical information once more. This procedure is performed without sedation. You will be laying flat on a bed in the minor procedure room and will be awake throughout. Local anesthetic agents will be administered directly to your eye to provide a numbing effect in order to ensure minimal discomfort. A typical pterygium procedure takes approximately 20 to 30 minutes. Topical drops will be used to numb and sterilize the ocular surface. Your eyelids will then be cleaned and held open for the duration of the procedure with a device called a speculum. Your surgeon will direct you in terms of which direction to look at various points during the procedure. The following animation will help demonstrate the steps of the procedure. The pterygium is identified and marked, and further local anesthesia is administered in the area. Both the conjunctival and corneal aspects of the pterygium are manually removed from the surface of the eye using specialized ophthalmic surgery instruments. An area of healthy conjunctiva is then identified, typically from the upper part of the same eye. A graft is created using this tissue and is glued to the site from which the pterygium was removed, covering the exposed sclera, or the white of the eye. The site from which the graft is taken heals within approximately 1 week. In certain scenarios, your physician may use an alternative type of tissue to close the defect and will discuss this with you beforehand. A faint haze may remain within the cornea after surgery due to the presence of the original pterygium. However, this is usually visually insignificant. To help with healing of the corneal surface, a bandage contact lens will be placed on your eye. This is typically removed in the office after approximately 1 week. After the procedure is complete, your eye will be patched to protect it and promote adherence of the graft. You will be instructed to remove this patch the next morning and begin your post-operative drops. Your bandage contact lens will be removed in the office at your 1-week follow-up visit. If it falls off of your eye before then, do not attempt to put the lens back in. If your eye is in pain, please contact the office by phone. The team will determine whether it is necessary for you to return to the clinic and have a new bandage contact lens applied. A responsible adult must accompany you and drive you home from our center. There is usually mild discomfort several hours after the procedure. It is common to feel scratchiness and aching. You can apply cool compresses gently over your patch or use oral medications for pain management as advised by your doctor. You may resume your other regular medications as soon as you get home. You will need to return for a follow-up visit with our optometrist approximately 1 week after your procedure. They will then direct you as to the frequency of further follow-ups depending on your healing. You will start your post-operative eye drops after patch removal for a total duration of 3 months. A drop schedule will be provided to help you follow the prescribed regimen. After the procedure, you may experience blurry vision, redness, and light sensitivity for several weeks. The eye will take approximately 8 to 12 weeks to fully heal. The duration of healing varies from person to person and even from one eye to the other. Post-operative precautions. It is important that you do not touch or rub your eye. Please use your eye drops as instructed by your surgeon. You can resume most of your usual daily activities, including reading and watching TV, as the comfort of your eye permits. Avoid ocular exposure to dust, dirt, water, or makeup for 2 weeks after your procedure. Please refrain from swimming and avoid direct water exposure to your eye while showering. Your surgeon will let you know when it is safe for you to resume driving. In the weeks after your procedure, it is very important to call the office promptly if you have severe eye pain, worsening redness, or a sudden drop in vision. If you experience any post-operative problems and are unable to reach the office, please go to the emergency department at the Ottawa Hospital or at a hospital near you. For any non-urgent questions about your post-operative healing, please email postop@precisioncornea.com and provide us with an explanation of your questions. If you live outside of Ottawa, please visit your nearest health center. Please note that removal of the pterygium does not directly correlate with an improvement in vision, but rather serves to regularize your corneal curvature. Your vision may need to be further optimized with a new glasses prescription or cataract surgery if deemed necessary by your surgeon. If your surgeon is planning to perform cataract surgery, they will need good quality measurements of your eye for surgical planning. This is done no sooner than 3 months following your pterygium procedure to allow adequate time for healing. If you would like to review the information presented here again, this video can be found on the Precision Cornea Center website under the Patient Resources tab, along with answers to some frequently asked questions. And that's everything you need to know about your pterygium procedure journey.